All right, good afternoon, everyone. It's Dr. Dan Ritchie, your host, and really excited to have Jordan Hamlin on today from Neuronic. And if you are not familiar with her company, it's definitely one that by the end of today, you're going to be more familiar and certainly encourage you to check out more. Jordan's a consultant with Neuronic where she supports clinicians and end users in understanding transcranial photobiomodulation and developing individualized protocols. She began her work in neurofeedback in 2016 at a clinic in Asheville, North Carolina, where she's still based. And she's board certified in neurofeedback and quantitative EEG, as well as a certified heart math coach. And I'll have her explain to you what that is here in a few minutes. But Jordan began studying the effects of visible and near infrared light on brain activity back in 2020, and she's worked, like I said, with Neuronic for the past couple of years. Her work focuses on translating neuroscience, uh, QEEG findings, and real-world clinical observations into practical guidance for safe and thoughtful PBM use. Her bio has some of the longer words I've ever had, which is a bit of a challenge. So, Jordan, thanks so much for being here. I'm going to turn it over to you. If you can share your screen, that would be great. I'm going to turn my video off, but I will still be here. My rule kind of for the room is type your questions in the chat. If there's a reason for me to interrupt Jordan, like she drops some term on us that five of us are like, what was that term? Can she define that again? Um, I'll interrupt Jordan. Otherwise, we'll do all the Q&A at the end. So Jordan, if you would please take it away, I will turn my video off and get out of your way.
All right, thanks so much. All right. And thank you so much for this opportunity. I'm really excited to talk about this today. So today we're going to talk about the brain energy connection, light therapy for cognitive longevity. And this is a practical introduction to gentle wearable light therapy for supporting brain energy, mental clarity, restorative sleep, and cognitive longevity. So why we're talking about this? Longevity, of course, is not only about living longer, it's about keeping the clarity, energy, mood, and resilience that allows you to enjoy those years. So a lot of times we hear once people are retiring, especially, and now they're dealing with a lot more brain fog, or maybe they can't remember where they put their keys as often as they used to, dealing with a lot more of that energy decline. So really struggling just to get through the day, maybe without a nap, and difficulty with recovery. So you hear about people who start traveling and then they just have to take a lot of time in between to recover from this. And longevity is really about preserving all of these things instead so that you can really enjoy all of this time. So that's what we're going to be talking about today and how photobiomodulation comes into this. So as was mentioned already with this, my background was I started working with neurofeedback in a clinic in Asheville, North Carolina. I really love neurofeedback. And then when COVID hit in 2020, kind of shut all of these hands-on practices down. So I started researching light at that time and kind of combining how EEGs and light went together. What are the effects with light on the brain activity? This was a really exciting time for me, and it went along well with my heart math coaching too, which is heart rate variability. And photobiomodulation was shown to help improve some heart rate variability. So it kind of tied into everything that I was doing, but it was giving me an opportunity to really focus in on research otherwise. And since 2024, I've started working for the company full time. I still work with EEGs and applying them for protocol development, but I'm working a lot more now in just the light field itself. So just to get our agenda here, we're just going to talk at the beginning about what light therapy actually is, because it is a lot more nuanced than it seems. How could this actually help you? Is this safe? How to get started? And then we'll have time at the end for a Q&A as well. And as was mentioned, it'd be great if you could just put your questions in the chat so that we can answer them all together at the end. So to start with, what actually is light therapy? So phototherapy or low-level laser or light therapy refers to the use of red or near infrared light to support cellular health. This is a non-invasive modality to support the body's natural processes. So down here at the bottom, we have that electromagnetic spectrum, which we might remember from school. Here in the middle, you can see that visible light. And on that left side of it, we see the red spectrum. And that red spectrum is what goes into the infrared spectrum. Infrared light is invisible to the human eye, whereas that red light is visible. I just want to make a quick note. There are other uses for different types of light that are on here, but for this presentation, we're only discussing about red and near infrared light. So why do we use infrared light? Well, light comes in different forms, and from the sun, almost 50% of it is infrared light. But in modern society, we've moved indoors now, so we don't get as much exposure of this infrared light as we used to. And unfortunately, that means that we're losing those benefits that from that light. So during this presentation, I'm going to talk about what some of those benefits are and ways that we're able to make this up. Since we moved inside, then what we have done instead is create technologies that can supplement this light. So there's two types of light therapy that you'll hear about. One is lasers. Lasers are often handheld. They have high intensity output. They tend to be used in clinical settings, and they do have a more significant heating risk. So you'll see a lot of this potentially for skin conditions, but they can also be used for other conditions as well that are deeper tissues in the body. On the other hand, we have LEDs, and these can be handheld or larger, including all the way up to sauna size. They have a lower intensity output, but that allows them to be used in a clinic or at home because they have a lower heating risk. So they're safer for individuals to use without becoming an expert in this field, and that we can still get these great benefits from the light. So what are the broad benefits of light therapy? Well, first is reducing inflammation and supporting waste removal. So studies have shown that photobiomodulation, in particular that red and near infrared light, can help to reduce inflammation in the body and also to help increase circulation so we can flush out more of these toxins. In addition to this, we see sleep optimization as a major component of infrared light therapy can help support sleep by reducing stress, enhancing that cellular energy, and helping the body to relax so that we can get into a good sleep cycle. Additionally, it can increase cellular activity. So a fundamental principle of transcranial or any kind of photobiomodulation is that it energizes cells by boosting ATP or adenosine triphosphate production. And this can help to support both repair and regeneration, as well as give us energy throughout our days. And finally, when we're talking about transcranial photobiomodulation, this can help to enhance brain functioning. So once we can improve that cellular activity, we're improving more of this blood flow, we're getting better sleep, then we're starting to see these improvements in your focus, in memory, and in mood. So we'll go through each one of these and starting at the beginning with reducing inflammation and promoting waste removal. So why does this matter? Well, what may be happening as we start to age, then inflammation can start to come in, whether that's through injury or illness, or maybe we're not taking care of ourselves as much as we should. This can lead to reduced circulation, which can make it harder for brain cells to receive those nutrients that they need and to be able to clear waste out. This cycle kind of builds on itself. So the more that you reduce the circulation, the less that cells get the nutrients they need, the more that you reduce more circulation. So where does photobiomodulation come in? Near infrared light can actually help to support that blood flow, nitric oxide signaling, and lead to a healthier inflammatory response. So essentially, the light can come in. We can help to get that circulation increasing. Circulation can move through the body and signal this nitric oxide release, which can allow for more circulation, which can allow for more cells to get the nutrients that they need. And what this can end up feeling like for somebody, since we don't necessarily notice those cellular aspects, is having clear thinking, less brain fog, better recovery, and a greater day-to-day resilience. So sleep optimization. What may be happening, and I'm sure we've all experienced this at some point in time, is getting some poor sleep, and especially poor sleep over nights and nights and nights. And poor sleep can reduce the brain's ability to repair, to regulate inflammation, and to clear waste overnight through that lymphatic drainage system. And photobiomodulation can help by supporting some nervous system regulation, that inflammation balance, again, like we mentioned in the past one, and healthier recovery during sleep. So getting better lymphatic drainage while we're sleeping. What this can end up feeling like is an easier time winding down in the evening, deeper rest while we're getting sleep, better morning clarity, and then more stable energy throughout the entire next day. So we see in multiple studies that repeated use of transcranial photobiomodulation helps to support sleep quality overall and reduces daytime fatigue. Photobiomodulation can also be helpful for increasing cellular activity. So, what does this mean? Aging, stress, and illness can all strain our mitochondria, which are the powerhouses of our cells and where we produce ATP, which is the energy currency for the body. When we have this strained mitochondria and disruption in the functioning, we start reducing the energy available to our body and, in particular, to our brain cells. So near-infrared light can be supportive for mitochondrial functioning by increasing and boosting that ATP production, which can help cells to produce and use energy more efficiently. So as those mitochondria are struggling, the photobiomodulation can be a supportive element to help increase that ATP and keep our energy supply continued. What this can end up feeling like is more mental stamina, being able to keep on with that really difficult task, like those taxes or those other unfun things we want to do, better focus, less cognitive fatigue, and improved capacity for daily tasks. So instead of just having that slump at 2 p.m., being able to really push all the way through the day and still feel good. And finally, enhance brain functioning. So, what may be happening when energy or sleep or circulation and inflammation are all out of balance? The brain may feel slower, foggier, or less resilient. So, each of these previous points that we talked on, especially if there's multiple going on at the same time, it can really start to drain our energy. And photobiomodulation can come in as a support for several foundational systems at once. One, producing that cellular energy, so increasing that ATP production. Two, with blood flow by decreasing inflammation, so we can increase that circulation. Three, with recovery by having greater resiliency to future stressors. And by brain network efficiency. So once we're able to get more of this cellular energy production, we're increasing the blood flow, we have more resiliency, the brain can have more functional connectivity so that it can work better. It's working smarter, not harder. What this can end up feeling like is sharper thinking, better recall, steadier mood, improved focus, and stronger long-term cognitive support. So in particular, these are all these important components when we're looking at longevity that need to be addressed in order to make sure that we can lead that life in the future that we're really looking to have. And dealing with each of these with a single kind of technology is pretty impressive. So a potential benefit is that resilience over time. And this is what we were discussing, that previous one, that ability to have a decrease of inflammation, that increase of that blood flow, and that recovery support. We're really supporting the terrain before decline begins. This is where you get the best outcomes. If you wait until something happens, it's going to make it much harder to be able to reach these points of health. If we do this ahead of time, then we have a lot better outcomes and resiliency to potential future stressors. When we work with clients, or if this is for yourself, then we notice the particular things that might not be just that people know their nitric oxide signaling has been moderated, but instead things like finding clear thinking, better recall, especially that kind of word finding, a more mental energy. In the daily functioning, we're finding easier focus and better follow through, ability to just kind of organize our days through and more steady mood, ability to make it through our days, even with all of our stressors, without being affected as much. And then recovery, having more restful sleep, less end of day fatigue, and that greater resiliency to again start you off for the following day. A big topic that comes up with light therapy is the safety aspect of it. So first, photobiomodulation is considered well tolerated by most individuals, especially with LEDs. We're really mitigating the heat risk factor. And so this makes it safe for home use for most individuals. And studies have actually even been conducted with children as young as 2 years old. So there's a lot of times we'll get questions about, an age and what age people should start be using this technology. If we can use it at 2 years old, at any age, it's going to be helpful for us. One of the most important factors, though, is dosing of photobiomodulation. And we talk about this at Neuronic in terms of the sweet spot. So sessions on average will range between 10 to 30 minutes and once or twice a day. Typically, the younger and healthier that someone is, the shorter amount of time that they'll need and the less frequency. The older and more compromised that someone is, the longer time that they'll need and maybe more frequency. What we recommend, though, at any point in time starting something new is just starting slow and building up over time to find your sweet spot. A lot of times people will find that there's a certain point where maybe they notice either a headache or they feel fatigued afterwards. It's very similar as if you were in the gym, perhaps in doing weightlifting. If you ran into the gym and you just picked up 100 pounds, most of us, that would be pretty difficult to do. So you'd want to start slower and figure out where that optimal weight was. It's the same thing when we're talking about light therapy as well. There are a few known contraindications I'd like to bring up. One is active cancer. Do say to avoid using light therapy if there's active cancer because there is a chance for angiogenesis, which is getting more blood flow to that particular tumor. Metal implanted in the head, so deep brain stimulation, or perhaps if we know there's shrapnel or something that could be in that brain, we don't want to use light therapy. It could potentially heat this metal. And a recent brain bleed, so we say to wait at least 3 months after a brain bleed before using any of this technology, just to give time for the brain to heal before then. We always recommend caution with pregnancy, although there's actually no information that's out there saying that it's unsafe for it. But because we always want to take extra caution with pregnant women, we just recommend taking caution here. So here's a little bit about Neuronix devices in particular. We have 4 different preset protocols that are on our device. This that's pictured here is our light helmet, and this is what's the best choice for the majority of people. It's a simple global approach all the way around the head, and it's run through an app on your phone. And once you get on the app, you'll see these 4 different protocols, and I'll go through each of these for you. So the first one we have is the Glow protocol. Glow protocol is the highest dose that we have. It runs for 10 minutes. It's continuous light. That's why here on the image, you'll see there's a dash for that pulse rate. There's no pulse rate at all. And it's at 100% intensity, which just means the light is on the entire time. We consider this kind of the crowd pleaser. It's good for almost anyone. It's good for recovery, it's good for persistent brain fog, and it's good for long-term cognitive support. It's kind of the one, if anybody's starting out using photobiomodulation, we recommend starting out with the Glow protocol because this is a really good general wellness protocol for most people. Second most used protocol that we have is called the focus protocol. This one is a moderate dose. So you'll see here on the bottom there, it's at 50% intensity. That means the light is on half of the time that you're running this protocol. A little bit more gentle than our previous one. And it pulses at 40 hertz. Now, you may or may not have seen this, but there's certainly a lot more devices that are coming out now that have this 40 hertz pulse rate. Some of them are flashing white lights that you'll see, or the MIT Light Lab utilizes this. So 40 hertz has gained a lot of interest in the past couple of years over its help for boosting cognition in particular. What they found when they put it into infrared light and shine it on the head, that we see these similar benefits, that they can be longer lasting because we're actually reaching in to get to the cells and support that cellular health as well. So this is really intended for a mental energy boost. It could be helpful for attention and focus issues, for older individuals seeking cognitive support, so especially older individuals who feel like their cognition is slipping a bit, their memory is not as sharp as it used to be, or even those who've been diagnosed with something like mild cognitive impairment or Alzheimer's. This could be a good option to offer. And it can be helpful for productivity or mental sharpness, just trying to get that peak performance and getting through your day. Next one we have is called Peace. Peace is a very low dose protocol. It's at a 10 hertz pulse rate and 20% intensity. So the light is only on 20% of the time. It's a very, very gentle protocol. And this is intended for calmness. So we utilize this a lot of times for sleep support. Using it in the evening in particular can be helpful for that in terms of winding down. Could also, though, be useful during the day as well, just to kind of keep that nervous system more grounded. We can also use it for highly sensitive individuals. Being at such a low intensity, it's a really gentle way to introduce someone into photobiomodulation and for stress or nervous system dysregulation. So those people who are just trying to get their bearings again, it can be a really helpful grounding point for them. The last protocol that we have is called balance. And I will be perfectly transparent. This is my favorite protocol, and that is a part of why it's here. It's a moderate dose protocol, so it is at 70% intensity. So the light's on 70% of the time, but it's only for 3 minutes. Really short burst. That pulse rate here is 14. So it's kind of in between these two of that 10 hertz for the peace and 40 hertz for the focus. We think about this as a quick pick me up. So it's kind of a good middle of the day, maybe a 2 p.m. slump could be a really good opportunity to be using this one. Busy professionals looking for a boost, you will only have 3 minutes. We just want to get a little extra energy. This is a good option for it. And individuals who find focus overstimulating. So while focus is a great choice for most people looking for cognitive sharpening, sometimes it's a little too much, like if you have espresso, and maybe that doesn't work for you. If that's the case, this one might be a good alternative. So we kept this one on the device as well. Each of these were chosen because they have the most research that's behind them at this point in the field. That being said, though, there is another option that's included on this device, which is to add a custom program. And this is just a point that's on the app that you can input anything here. So the custom protocols, why would you use this? Potentially to create shorter or longer durations for the previous four protocols. So perhaps somebody really loves the balance protocol. It's only 3 minutes, though. Maybe you want to have a longer session for that. On the other hand, maybe, you're using the peace protocol and it's too long for a really sensitive individual. You could program a shorter time for this. Another one is to increase or decrease intensity for a protocol. So a big one is we have focus at 50% intensity. That's kind of a moderate dosage. Maybe you're somebody who needs a little bit higher of a dosage. In particular, often with a lot of my clients with cognitive decline, this is one I'm going to program a higher dosage for. So you could have the same settings, that 40 hertz, same time, 6 minutes. You could put it up to 70 or 80% intensity just to get a deeper and higher dosage for the individual. It could also be used to combine multiple protocols into a single session. So there's research that's shown that combining our protocols glow and focus together could have greater impact on cognition. So it might be helpful to have the two of those, especially for someone who might have cognitive decline. That might be a little bit more for them to try and keep up with if they have to remember to do two different protocols in the app. An option is that they could program them together into a single protocol called Glow and Focus, or maybe Morning, and then that way they would know to be using both of these. And finally, we have it to adapt to new science. While our four protocols are the most researched at this time, and there is not any other protocols that are as compelling as these, that could change. This is a constantly evolving field, and we want your device to be able to change with the field as well. So just in case something new comes out, instead of you having to purchase another device, you can instead set your device to this one. And we will also send out any new notifications if there is new protocols that we'll release. But a lot of us might be ahead of the times. You'll have this option for yourself too. So as a broad overview here, which protocol fits the goal? Because you'll always be asked about this, or perhaps are thinking about it for yourself. Glow is going to be great for that continuous recovery, long-term support. Kind of when in doubt, go with Glow. Focus is a really great one for mental energy and sharpness. So a great one for the morning. It can be really energizing and helpful for the day of getting through a lot of tasks. Peace is really great for that calm and sleep support, so it might be a good one for the end of the day to help wind down and go into bed. And balance can be that good quick daytime boost. So, like I mentioned, maybe that 2 p.m. slump, it could be a really good option. So how do you fit this into an actual wellness routine? For users, the strongest message is simple. It's a low friction brain support habit that can fit alongside your sleep hygiene, your movement, your nutrition, and stress regulation that you're already doing. So it could be used before workouts to support readiness and mental engagement. It could be used during recovery, either after workout or after a harder day, to pair with breath work, meditation, or post-session rest and just to be used at home in general. So you could use it, for instance, in the morning with your breakfast, or to be using it in the evening, perhaps while you're winding down for the day. So it's really meant to fit in with all the other things that you're doing and just support all of these to work together well. I'd like to offer, if anybody is interested, that you can book a free 30-minute consultation with me. I'm happy to speak with you more, especially if you have any specific questions. You can either use this QR code to be able to get the link, or you can email me directly. My email address is here. I'd be happy to meet with you and speak about this further. And just in case if any of you are ready to purchase, I wanted to go ahead and give you a code. It's here, that Dan Ritchie 1058, and it'll give you $100 off our device. So definitely take a picture of this. You'll want to save that one as well. And that is the end of my presentation. So I'd be happy to take questions.
Awesome. Thanks so much. Yeah, go ahead and type your questions in the chat. We'll try to get to as many of those as we can today. Um, I want to ask the question. In fact, 3 or 4 people in the chat said they were fitness professionals. So, for the fitness professional watching or listening on the replay, um, what's the best strategy for them to get this in the hands of their clients, or even start talking about educating their clients of, hey, this might be a good tool for you for, recovery time, might be a good tool for you before you come in for your session. If brain health and cognitive issues are something they're concerned about. So how's a fitness professional, do they stock this thing on their shelves? Do they sell it online through your store? How's that work?
Absolutely. So there's a lot of different ways that we can do this. One, I do recommend having one that you have in your actual gym because when people get their hands on it, they can feel it and it becomes tangible. They're a lot more likely to be able to purchase afterwards too, but also it gives them an opportunity to try it. You'd be surprised how many times I've found us going into places and just simply putting a helmet on somebody's head. Like, whoa, I actually feel this now. So it's really great to have in your clinic for people. Additionally, though, you can have it that you can list it online too. We have a ton of resources on our website as well. So you can always link it back to our website so that people can read further research, especially if they have particular conditions or concerns or things like that. And we try to put out as much information as possible. It's a great way to do it too. But yeah, we have a lot of people who will just put it as kind of part of their recovery services in their gym. So just like you'd have your sauna, that could be something to help with recovery. The same goes for our brains as well, especially with a lot of our potentially, athletes or other things that come in. You might be getting head injuries more often. It's a really great tool to have that they can just help some extra recovery too.
So do you see, physical therapy clinics and fitness studios actually having this and charging for it? So like I come in for my physical therapy session and I pay for 10 minutes of light therapy for my brain, or is it a bonus? I mean, how are people charging for it?
Yeah, so in general, either it's going to be included in like a membership type package, so you would charge a little bit more. So it could be something that people could use like in a pod setting or something where it's a standalone modality, or that you're putting it into a specific regimen for individuals and then charging for that service one off. So there's different ways to go about it and depends on what really works for your facility. But yeah, we have a lot of people who will just use it as people can come in. Again, they can have their own app and be able to run the same helmet. You don't have to have a phone or a single tablet that's out for it. Multiple people can connect to it. So they can actually run a session themselves. So especially if you have some kind of package deal and you're including this in it, can be a really great way to do it. But individual sessions is another way as well.
Okay, okay. So it could be a revenue add-on. Um, okay, just so everyone's aware, I forgot to say this. We did record the entire session, so if you had trouble logging on or you joined us late, the recording will be sent out to everyone. If you need to leave now, you'll get the Q&A. So the replay will be available. And Jordan, I will put the link to schedule with you in the email that goes out as well, so people have that. It was in her presentation. You can find it, but Brett has a great question. So it's kind of a two-parter. First of all, who is this really recommended for? Like, should everyone be using it, or is there more a specific population? And then is this recommended in addition to or a substitute for, say, just getting out in natural sunlight, getting, our healthy dose of sunshine?
Sure. Yeah. So first about who it's recommended for, I absolutely think it's recommended for everyone. I've certainly been using mine for the past 3 years now that I've had it because it's really great for that prevention aspect. I think a lot of us too, I mean, especially being in the fitness world, probably were sports players as well in the past and maybe had a couple of bumps on the head along the way. Those things can show up and cause problems much further down the line. And so it's really good to be doing these preemptive things to be taking care of your brain health. In addition to that, individuals we know about TBI, individuals who maybe have that ApoE44, so that genetic marker that's, puts you at a greater disposition for developing Alzheimer's. It's good to do preemptive things. And people who've dealt with long-suffering illnesses as well, because those are things that could potentially break down the blood-brain barrier. You could run into other issues that can again cause cognitive decline further down. And again, I also work with a lot of children. So I work with a lot of children on the spectrum as well to try and help with that neuroinflammation. So it's a really, really broad spectrum of who this can be helpful for. We've even used it for Rubik's Cube champions to help with peak performance. So there's a lot of different applications here. And then in terms of, having this versus being out in the sun, obviously a big part of being in the sun is that we do risk that exposure as well to the UV and harmful UV sides of it. So where you end up going out, you're kind of covering a lot of the body if you're trying to do this safely, which will limit your penetration from that infrared light, or we're doing it unsafely, which could put you at risk for that UV. Definitely should still get natural daylight. We absolutely recommend that. It's good to do in the morning before it gets really intense later in the day. But just because of this shift with how we've moved indoors, it's really helpful to have a supplementary technology. Also, there's a lot of people though who live in a place that we don't get as much sunlight as the rest of the time. So it's good to have this supplementary aspect as well for that. But yeah, I don't know if you guys are dealing with the heat wave, but we certainly are. And there's no way I can spend that much time outside to get the benefit.
Yeah, extremely, extremely hot here. So it sounds to me like you narrowed it down to basically anyone with a brain, it can
Yeah,
be helpful for. So it's not like you have to have had a brain injury or have to be showing signs and symptoms or anything of that nature. So for the person who is listening thinking, oh man, I've been definitely struggling with some brain fog, or just my focus hasn't been as sharp. Is this a tool that, used regularly could help them with that?
absolutely. Absolutely. It's so important for that. And again, these are why it's so important to do this ahead of time before you start seeing worse results later on. If you're dealing with some brain fog, you're dealing with some difficulty with that, mental stamina or other things, you want to go ahead and do things now before it compounds on it. And like I mentioned in this, the sleep aspect is such a big thing. I hear it all the time of people with poor quality sleep for one reason or another, especially if you have kids or pets or other things that are just interrupting your sleep all the time. That also compounds on itself. So it's really good to have something to support this recovery with it. So I highly recommend it for, yeah, anybody with a brain.
Okay. Sue's asking, how is the technology different than the red light helmets being advertised for hair growth?
Great question. I get this all the time. It's a really, really important distinction. Yeah, so red light does still fall into the same category, and we see similar benefits. But the biggest difference is it's not able to penetrate as deeply. So red light can really only reach about skin deep, which makes it fantastic for hair growth or for your skin. Those things are great for it. But trying to get through, actually through the skull, through the meninges, and then down to this brain tissue, that's a lot of layers to go through. Red light light's just not powerful enough for that. So we move into that infrared light range. So you'll see a lot of devices at the 850 nanometer and then ours at the 1070 nanometer. And this is just chosen so we can get through all of these layers to actually help support that brain tissue. And I do also get this question a lot. You can still use a red light helmet and use our helmet. The red light helmet for hair growth does not interfere at all with this. You can still use both of them. So it's not like one excludes the other.
Starting to wonder if Sue asked that just because of me, but I'll move on. Janine asks, and this is a great question: is there a limit to how often to use this? Is there a daily beneficial? Is there such a thing as overuse? So, of course, the question is there too much? I mean, well, if you say 10 minutes a day, well, then I'm going to do an hour a day.
Right, right. Absolutely. So light therapy works on a biphasic dose response, meaning that too little of it doesn't really give us much benefit, but too much can negate the benefits. Now, in light therapy with LEDs, that too much doesn't tend to be necessarily harmful. To a certain extent, at some point, it can definitely be harmful, but you have a lot more range with it, but it can just negate all of your positive benefits if you're pushing past. Each device will have its own limitation with it. So it's really important to look at the technical specificity for any device you're using. For neuronic devices, we recommend a maximum of 30 minutes in a single session and 1 hour total in a day that's broken into two 30-minute sessions. You might not need a full 30 minutes. So I have that kind of argument with people sometimes is that they're like, I'm trying to push myself to get there, but I don't feel good if I go past 20 minutes. Don't then. Like it's about where it works with your biology. And one of those things that I have noticed that I mentioned in the presentation is typically the younger and healthier that someone is, the less times that they'll need. So they might do more like 10 minutes a day and only once a day if we're talking about maybe a teenager or someone in their 20s who's relatively healthy. On the other side, if we're talking about someone maybe in their 70s or 80s who's experiencing cognitive decline, they're more likely to use it for longer sessions like that 30 minutes and to use it twice a day. But yes, there is overstimulation. Most often that will you'll feel it as either a headache or fatigue. So those are two things to look out for when you're using light therapy. I do want to mention though, most of the time it can also be mitigated by just drinking extra water. So whether you're using it or you're having clients use it, just have them drink a glass of water before and after.
Okay. Brett is asking, is the device being used to help people with depression and or any other disorders? I think he's specifically talking mental health issues.
Yeah, yeah, absolutely. So there's been a lot more push for depression in particular over the past couple of years, and showing that kind of this increase in cellular energy makes it easier to go and do the things that will help somebody to get through this. So it's definitely been seen for depression, for anxiety, for general anxiety disorders, and for PTSD. It's been utilized for both of those as well. And in those situations, I might be moving towards like that peace session, trying to get more of that calming. Um, those are the primary ones that it's been looked at. Of course, there's one-off studies for some other things, but yeah, anxiety and depression are really big topics in this field.
Now, I mean, I start to think about the practical aspect of time when you talk about two 30-minute sessions, already struggling to get, 70 and 80-year-olds to do all the strength training they need to do and the balance training they need to do and the other exercise. Um, can they do other things while they're wearing it? Like, can they, be watching television? Can they be having a conversation on the phone? Or do they have to be sitting still in a quiet room? Like, can they get other stuff done? Can they be doing the dishes and walking the dog?
Yeah, yeah, absolutely you can. So it's a portable device. I know I probably didn't spend a lot of time on the slide with it, but yeah, our helmet just has a USB-C cord with it and a portable battery. So you can just slip it in a pocket and go along. I have one of my clients, he likes to vacuum while he is doing it, which I think is fantastic if that's what you want to do. A lot of people who are using it while they're doing dishes. During mealtime, it's a great one as well. You can do a lot of different things with it. One of our occupational therapists uses it with their kids, in particular in a playroom that they have. So the kids are just playing during this and having the helmet on. It makes it so much easier. So really anything that you could possibly do that while you have something on your head, you can do it at the same time.
Okay, that's great because it's not like, oh, I got to set aside another 30 minutes for another exercise routine.
Exactly.
Um, so I have one more question for you, but I do want to see if anybody else in the room, I think I got to everybody's question in the chat. So I want to just sort of ask you, and you I didn't prep you for this, so you may or may not know, but I'm curious sort of the future of this and where is this going in 27, 28, and beyond. All the stats I see are projecting that Alzheimer's is going to go from 6 million people in the United States today to 16 million in about the next 10 to 15 years. Now, a lot of that is due to the baby boomers are going to be entering their 80s in the millions, right? So, what's your prediction in terms of Neuronic and even other light therapy devices for brain health, cognitive decline, dementia? Is this going to become a commonplace thing? Because I feel like the vast majority of people still are not aware of it, don't know it's an option, don't know it's out there. So, kind of give us your future outlook on, you know, like, are we hearing from you today and 2 years from now, we're gonna be like, oh, these things are everywhere.
Right. I mean, I certainly think so. I mean, especially when I feel like with this statistic, knowing that we're going to have this kind of boom and this cognitive decline, I feel like a lot more people are more aware about this and they're trying to be more proactive. So I think that's going to be a really big part is people are starting to look more on how do I prevent this instead of just waiting until things happen. So I feel like that'll be a huge part of what can increase this popularity. But the other thing is that it's been shown to work really well with other modalities as well. So we've seen this kind of boom in the past, 2 years or so with maybe peptides or these supplements or other things that are coming out, which each individually could have really great impacts. But when you can start to incorporate them with photobiomodulation as well, I think you can start to see impacts increase as well. So I feel like it's a big thing that can help it move forward in the field. The other side, though, is it's affordable. This is not something that you're spending $100,000 on or even $10,000 on. These are running $1,800 for it. It's something that you have for life. It doesn't require maintenance. It's a really easy thing to share with your family. So it's something that's, really achievable for more and more people now too, which I think makes a big difference than some of the other things like somebody buying a full light bed might be a lot more difficult to have in your home versus a helmet is something that is more achievable. I do think too, though, that the recent change in kind of seeing more of the light beds or like the light therapy mask is also a helpful point because at least now people are getting it more regularly in the routines. I've seen tons of commercials that at least either make fun of the light therapy mask or they're supportive of it.
Yes,
But you're seeing
yes.
it so much more often. And I'm excited for it because one, I think it's a great thing to have, but two, it's going to help people start to understand better about near infrared light, which is a little bit weirder of a sell since you can't actually see the lights with your eyes versus red light you can. But the more people learn, the better that it'll be.
Yeah, and I mean you bring up a great point. For $1,800 for a tool that's gonna impact your brain health for years to come. So let me ask, I'm a household of five. Do I have to have five of them, or is one gonna be sufficient for my entire household? And how long is it gonna last? Does it have 2 year warranty? Is it, I mean, like these things lasting 5 years, 10 years? Do I gotta buy a new one every year?
Yeah, great question. So yeah, we've had people in a household of five people who have a single helmet and everybody just lines up in the morning as they're getting through their routine to put the helmet on. So absolutely it can be shared with everyone in the house. Each person can have their own account for it so that they can use their own phone or you can be sharing them. So I certainly work with a lot of parents with children. They are going to be monitoring that account for them. So that's really helpful just to be able to share with it, or people even sharing with their neighbors. And in terms of the durability, yeah, because this has so few components to it, it's a really durable piece of equipment. So any device that you get will automatically come with a year-long warranty for it. We also offer an option for what's called Neuronic Care, and that's another 3 years warranty for it. So you have that additional side. We've done third-party testing to look at that length of the lifespan for the LEDs, and they know they're at least 100,000 hours, and that's the most that you can test for with it. So we know they're pretty durable for that. And really, the most, guess fragile part of it could be maybe that USB-C cord, but that would only be if maybe you're running over your cords or something like that. Otherwise, yeah, they're really durable for everything. So it's great to have. Plus, since you have an account for that app, you can actually, even if you lost your phone or something like that, you're able to get all of your data back again too. So you can still continue tracking it as well. So really, it's definitely a durable piece of equipment. And like having that custom programs, you can also adapt with the new science just in case new things come out.
100,000 hours.
Yeah.
That's a really long time. So I mean, if you used it for an hour every single day, it's gonna last you for years, right? Like more than your lifetime. So that yeah, that's certainly good to know. So um can you put up the slide again as we wrap up for people to book a call with you? Because I know people are gonna be like, wait, where was that slide again? So if you want to learn more, Jordan would love to meet with you. She's given you her email. And I know some people listening on the replay I know the first thing they're thinking is, oh, I really want to ask a question for my mom or about my dad, or I want to get this thing for a family member, or, the first thing they're thinking about is someone they know that is beginning to struggle with cognitive issues or fearing it, or, knows that's going to be a concern. Not that we shouldn't necessarily be all thinking about this tool for ourselves, but book a call with Jordan. Email her. She's given you her email. She wants to be a resource for you. So, Jordan, thanks so much for your time today. Thanks for what your company's doing. I think this is it's a very hands-on resource that is very affordable for most people, right? Like you said, it's not a $10,000 program. It's not $100,000 intervention. It's something that most people can afford, and especially if you're thinking about a couple in their 70s, it's $900 for each of them if they're sharing it, right? A family of four, it's really an affordable tool compared to, we all know people have ordered $1,000 treadmills that become clothing racks. So the one benefit here is nobody's going to hang their clothes on this thing, right? So hopefully they can continue to use it. So again, Jordan, thanks for being on. If you're on the replay and you really wanted to ask a question, well, just email her. She'll be happy to be in touch with you and even hop on a call. So thanks everyone for being on live today. And I hope you pursue this and definitely check it out. Thanks, Jordan.
Thank you.